All new at 10 neighbors in northern Greenville County are demanding a local emergency room be reopened after Prisma Health announced it was permanently shuttering North Greenville Hospital's ER. It's already been temporarily closed while it served Upstate's main COVID-19 treatment centers. Well, Prisma says the North Greenville ER was already underused and that it will actually benefit the community in the long run, but some local residents disagree.
Fox Carolina's Matt Koufax joins us live with the story.
Yeah, Cody, Tori, Prisma Health says that actually closing this ER will help because they are going to transition into a new phase where residents will be able to better explore their primary care options, which is where they say that community's need is greatest at this moment in time. Meanwhile, hundreds of neighbors, as you mentioned, have signed a petition to reopen it, citing worries about medical care for critically ill patients.
Dr. Wendell James with Prisma Health says North Greenville's ER has been seeing less and less patients since the facility moved to COVID care.
The volumes at that emergency room dropped to very, very few patients per day. I mean, on the order of single digits before it was over with.
He says just because it's closing doesn't mean they're leaving people high and dry, and that what they're proposing for the facility's future involves making it into a primary care center with walk-in and eventually specialty care options.
Continuity of care that you can't get in an emergency room, and so they get the right care at the right time at the right place, and it'll be at the right price for the patient.
I'm worried that the senior citizens and the poor people of that area are going to be directly affected.
Some neighbors like Michael McCord disagree. He says many already don't have reliable transportation.
If you're having a heart attack or a stroke or a bad car wreck or you've had a hiking accident up there, those minutes count.
But James says patients in those life or death situations are already being driven straight to Greenville Memorial anyway.
All of those are being, for years, have been coming straight to the trauma center or the cardiac center for that.
McCord has helped residents in areas like TR and Slater Marietta, who he says feel left out, to organize a petition.
They say that, it was underutilized, but if it saves one life in northern Greenville, it has served its purpose.
Meanwhile, James says this new option could potentially save more lives through preventative care in the long run.
Emergency coverage for that area of the county will really not change.
McCord and others who feel strongly about their issue, they are encouraging them to sign the petition so they can circulate it and get the word out there. Meanwhile, James tells me that Prisma Health is already looking towards the future when this facility in northern Greenville County will no longer be a designated COVID care spot, and instead they can begin making it into what they want it to be and transitioning it into this new phase of operation. Live tonight, Matt Koufax, Fox Carolina, the 10 o'clock news.